Hi, it's wonderful to be here, and thank you to Kevin for inviting me, and to all of you for your dedication to patient safety. I actually became involved with Open Notes as a patient advocate for patient safety and patient experience, patient and family engagement, and healthcare technology in general, and the patient portal in specific. And what I'm going to do is give you a quick introduction to Open Notes. So Kevin just gave a really good one to part of what I was going to share. And then talk about my son Josh and the story that brings me here and to this advocacy. And then some more about how that brought me to what I recommend for the patient portal and Open Notes and some action steps to consider. So as Kevin said, what is Open Notes? It's simply having access that I think we all deserve to our own medical chart notes through the secure patient portal. And Open Notes, who to be clear, I do not work for myself, but I'm really a big fan and honored that they asked me. It's not a product or software, it's a movement to get that access. And I'm happy to share that it's now implemented in 150 health systems, giving 27.5 million Americans access to their records. So Open Notes is such a wonderful way to engage patients and families because giving you access to your full chart notes gives you so much more information than what you would typically get in an after-clinic visit summary. And patients have a federal right to their chart. It is part of our rights. So just to start, I'm curious to ask how many of you have actually, if you could raise your hands, have actually accessed your own patient portal online? Thank you. And of those who have, the last time you were looking for something, did you find what you were looking for? Can you raise your hand if it's a yes? Great. And I'm guessing the answer to the next one is what Kevin kind of talked about a little, is how many clicks does it take? And this is one of the issues, is it's great to have access. I saw 3 clicks, and I'm not surprised it's typically 3 or 4, and where can I find them is the challenge, right? So my story that I'm about to share kind of highlights the value, I hope, of transparency and making that portal accessible and encouraging people to use it to increase patient safety and improve health and outcomes. So my husband David and I are very lucky because we have 2 wonderful sons who have always been very close. My younger son Josh had a very active, healthy, normal childhood until he became incredibly ill at 13 years old. He prided himself before then on running like the wind, which I can attest to from trying to keep up with him. A straight-A student, loved to learn. We watched his accomplishments with pride. Until the summer of 2014, he just had a great time at summer camp. We're hanging out in the family room one night. He leans into my husband's shoulder and says, "Dad, can I ask you a question in private?" My husband, a scientist, thought, oh boy, I can handle whatever birds in the bee question this kid has for me. If only. Instead, Josh asked him, "Dad, is it normal to have some blood in your poop?" My husband, taken aback, calmly changing gears, said, "Let me ask you some questions about that. How long has it been going on?" Explained, of course, we're not keeping this from Mom. We need to all help you together, and we need to see what this looks like. That first sample was really shocking. It looked like a crime scene, more accurate to describe a pool of blood with something in it. In August 2014, Josh had the first of what was to become 6 colonoscopy endoscopies in his first year, and he was diagnosed with inflammatory bowel disease, Crohn's. It started with inflammation in his colon with some backwash in his terminal ileum, but it looked more normal, so to speak, in the beginning, but like a nasty video game monster, to use my son's terminology, that disease would act like it might respond to whatever his wonderful medical team at Rainbow Babies and Children's Hospital in Cleveland tried, only to spread and attack further. Nothing they tried, that is the normal things to try, worked. He got sicker and sicker till he was in the hospital more than out. President's Day weekend 2015, curled up in a ball of belly pain when not in the bathroom with endless diarrhea. He turned to us and said, "I need to go to the hospital." Not something we'd normally hear from him. We entered the hospital February 17th, 2015. We did not come home until the end of September, almost 8 months. The next colonoscopy showed that now the inflammation was everywhere throughout his entire digestive system from top to bottom. His wonderful Rainbow GI called top academic centers around the country to consult, and no one had seen a case like this. We still tell Josh today, when you were little and we said be unique and special, just so you know this is not what we had in mind. We were transferred by medical flight to Children's Hospital of Philadelphia to access their pediatric IBD center, and we lived there for almost 5 months. These were dark days with Josh desperately ill, living with a commode at bedside, throwing up when he wasn't putting out 2 to 3 liters of secretory diarrhea a day. To watch your child suffer like that, knowing there was only so much science or medicine could understand to do or help him, was beyond painful. So we learned everything we could. Luckily, CHOP involved a top NIH GI immunologist who understood the likely unusual path of his disease and recommended a new unusual medication to try. And thankfully, Josh started to slowly respond. But he still needed to be hospitalized for a long time while he recovered. And we were glad to finally be able to go back to Rainbow where we're more comfortable and closer to home, and then finally get to go home the end of September when he was doing better. Being unique and special, Josh also has other conditions that are unusual, including a liver biopsy revealed that he has early stage liver disease. Though thankfully his liver enzymes are now normal. And then early 2016, we noticed him start limping, and we're thinking, what now? And it turns out he has a vascular necrosis in his right hip from the prednisone. Or at least that's our best guess. And so they did emergency surgery to help mitigate the impact on his femur bone. And that is the height of the journey. Luckily, I'm happy to share that Josh is doing well now. He is a high school senior. His health is stable, and at 17 years old, he's learning how to handle things for himself and learning about the diseases and how to advocate for himself. And he feels so fulfilled and happy knowing that NIH is not only still consulting on his case and helping with his treatment, but also that it has allowed the NIH research to go further. And he hopes that, as rare as it's been and difficult for him, that is helping other people get better. So now he's doing what a normal high school senior should be doing, like, getting ready for college applications. And he loves to say, "I will not let my colon get in my way." So he plans to major in biomedical engineering and wants to invent devices so that he can use his experiences to help people. And I have tried to use my experiences to think, how can I make a difference? What have I learned? What have we learned as a family? And one of the things is how incredibly helpful the patient portal can be. And when we're talking about patient safety, I really believe that the personal health record empowers because it gives that access to information. It enhances patient safety, experience, and communication. For those who have medical complexities, it helps learn what to track and monitor and be able to do so for yourself and have that conversation with providers. But it's also so helpful for healthy people to ensure preventive care and try to avoid developing problems in the future. Best of all, I believe it is a really essential physician and nursing tool to motivate and engage patients and families in their health care. We really appreciated that all of these different specialists, the number of them in particular at the different institutions, have done a great job of trying to educate us about the different diseases. But what I also really appreciated is that some of them went the extra mile to show me how to access in the patient portal and use things the best way possible so that I could see things like key lab results and trends for myself. It took them a few minutes of time, but for that little bit of time, it paid them back in probably me not calling them as often going, how is the whatever, doing that I'm worrying about? When you have chronic illnesses, it really takes away that sense of control in your life, and I feel like the portal helped give back some of that control. In addition, I love using physician and nursing messaging. That is when the physician or nurses that we're working with actually use it. It's very helpful for being able to ask a quick question and have something to look back on if I can't remember something. And I really love, especially because the reality is patient portals are different systems, different health systems and providers use different ones. So I have all the apps on my phone, and it's great to be able to pull them up and share medical records and coordinate care between providers. Now I want to dig more into open notes and how I really believe it improves the quality of documentation. So traditionally, the purpose of a medical chart note was to communicate with other clinicians, for the clinician to communicate with other physicians, and for billing purposes. Now we move to the next phase where you want to move into collaboration and co-generation of notes. There should be that strong relationship between provider, patient, and family. Open notes will gradually improve the quality of the documentation because you see this transition in traditional language, which tends to say things like the patient admits, the patient denies, or my favorite, the acronyms like SOB for short of breath. And it can be tempting to think when people are healthy, well, why do I need to bother to go to this trouble to look into my patient portal and never mind go into open notes? But the reality is, according to the CDC, 1 out of every 2 Americans has a chronic illness, and 1 out of 4 has 2 or more. And I would submit that Josh, as I mentioned, was perfectly healthy from our perspective until he hit 13 years old. So things can change. So in terms of patient safety, our focus today, it is logical that rather than just the 2 sets of eyes of the clinician who wrote the note, if you have it open and patients and family can see them, again, through a secure portal, more sets of eyes help catch problems before they happen. It's really clear, and I've seen this myself, you can catch things like wrong medications, dosages, diagnoses, descriptions, clinician names. I mean, things happen. But what I also really love, again, is being able to engage patients and families and color in the lines of the patient experience. We know that patients and families, and I experience this all the time myself, whether you're in a doctor's visit or nurse practitioner or hospital stay, when you go home, I always think, oh, I'm going to remember everything we talked about. I'm going to remember the instructions fine, and I go home, and we look at each other, and we go, what was that thing, that other aspect? And being able to go in and look at the chart notes allows you to really see that full care plan. And sometimes it helps you to also clarify, wait a minute, I'm not sure I agree totally with that, or I have a question, and that's okay. It doesn't mean that everybody has to agree, but it's better to make it clear, right? So the next thing I want to talk about is patient and family advisory councils. And I was wondering if you could raise your hand and say how many of you, are any of you involved in a PFAC? Patient Family Advisory Council. Okay. I am for Rainbow Hospital. So a Patient and Family Advisory Council, and for any who don't know, is a collaboration between patients, families, medical staff, other kinds of staff, to help improve patient and family experience and to actually engage patients and families in making decisions for policies, programs, procedures, often include patients and families in committees that are standing committees for a hospital or health system. And I have seen great things from this. And patient and family advisors can be great advocates for implementing open notes. And I am proud to also be a member of the new National Health IT PFAC that was created by Open Notes and another patient nonprofit called PFCC Partners. And there's 12 of us patients across the country that are in these virtual meetings talking about how can we make patient portals better, including things like how many clicks does it take to find information. So action steps. First, I hope that I've intrigued you in Open Notes, and if so, I want to say, again, patients and family advisors can be great advocates. Their website is a terrific resource. It actually has a map listing all of the health systems that have Open Notes, and you can see some quick tips in the slide about, if you are interested in finding out more. But also take note, they have a lot of good research and data. You make all the difference, and I'm thankful for all you're doing for patient safety and for patients. Another thing to think about if you have the opportunity to be involved in Patient Portal in any way is whether it can be integrated into patient education efforts. For example, for patients of a particular population or demographic, certain diseases, like maybe if people are doing diabetes education or cardiovascular, can the patient portal and showing them how to use it and really get in there and show a few quick tips can be integrated into that. And then the other thing is being enthusiastic, whether nurses, staff, the frontline staff, about signing up for the portal, but just as importantly, the benefits of using it. And then because life happens and things go wrong with technology all the time, is just allowing staff to also have information about a website or a phone number they can refer patients and families to because they will inevitably say, I can't access or I'm having a problem. The portal is truly a personal health record. Yes, it's a regulatory requirement now, but I really think it can be so much more, as I've been talking about, and I hope I've inspired you in my story and also in just some of the ways that I have found the portal to be useful and that Open Notes has potential to play a role in improving patient safety. So just like you would want to see patients educated about different things to avoid adverse events, that the portal can be part of that process and encouraging people to be in there and look at your own information and ask questions if something doesn't seem right. This is just how I'm trying to make a difference and doing things like today. And then here's my contact information. I would love to hear from you and discuss this further. Thank you.